flu viruses are responsible for infecting a person's respiratory tract, including the nose, throat, and lungs. Individuals who have the flu spread these viruses through coughing, sneezing, or talking, which sends droplets containing the virus into the air and, perhaps, into the mouths or noses of people who are nearby. It is also possible to contract the influenza virus by touching a surface or object that is contaminated with the virus and then touching your own lips, eyes, or nose afterward. It is possible to spread the flu even before you are aware that you are sick, beginning one day before your symptoms appear and continuing for up to 5 to 7 days after you have become sick. Beginning one day before your symptoms appear and continuing for up to 5 to 7 days after you have become sick. Some individuals, particularly younger children and those with compromised immune systems, may be able to infect others for a significantly longer period of time than others. In this video, we are going to discuss the different types of people who are susceptible to catching the flu. The video is going to be very interesting, so make sure you stick till end. Before we continue to our video, make sure to smash the like button, subscribe to our channel, and hit the bell icon to never miss any of our future uploads. Now let's get started. For those who are at a high risk, influenza can be an extremely dangerous sickness. Chronic lung diseases such as asthma, COPD, bronchitis, or cystic fibrosis, heart disease, chronic kidney disease, diabetes, or other chronic metabolic disorder, morbid obesity, severe anemia, including sickle cell anemia, diseases such as HIV, AIDS, or treatments such as steroids, chemotherapy that suppress immunity, liver disorders, and children and adolescents who are receiving long-term aspirin therapy are all associated with an increased risk. Number 8. Infants and children. Children younger than 5 years old, and especially those younger than 2 years old, have an increased risk of suffering significant flu-related complications. This risk is especially high for children younger than 5 years old, because children fewer than 6 months of age are too young to be vaccinated. The best method to protect them is to make sure that those around them get vaccinated, as well as to ensure that moms be vaccinated while they are still pregnant. Vaccinating individuals who are around them is also important. The flu poses a significant risk to youngsters. Complications might manifest themselves in a variety of ways, including dehydration, ear infections, pneumonia, hospitalization, and even death. Number 7. Adults age 65 and older. The decline in immune function that occurs naturally with advancing age contributes to the increased likelihood of influenza-related complications in those who are 65 years of age or older. During the majority of flu seasons, elderly people account for the vast majority of flu-related fatalities, as well as more than half of all hospitalizations caused by the flu. Adults who are 65 years old or older are encouraged to get one of several vaccines, including high-dose, adjuvanted, or recombinant influenza vaccines, because these vaccines help adults develop a stronger immune response to the virus. Number 6. Pregnant women. It is more likely for pregnant women to cause serious disease than it is for other women, and the risk of hospitalization for pregnant women who become ill with the flu is significantly raised. Multiple studies have found that infants whose mothers receive a flu shot while they are pregnant are protected against getting the influenza virus for several months after they are born. This protection lasts for the duration of the mother's protection from the virus. People with certain chronic health conditions. Number 5. Heart disease. Patients who already have heart disease have a 6-fold increased risk of having a heart attack within the first week after contracting the flu. Those who have heart disease or have previously suffered a stroke have a significantly increased likelihood of developing serious flu-related complications, including the possibility of death. Even weeks after flu symptoms have subsided, people who have heart disease may experience a worsening of their symptoms due to increased inflammation brought on by the flu infection. This leaves these individuals vulnerable to permanent loss of function and disability. Number 4. Lung disease. People who suffer from asthma or chronic obstructive pulmonary disease, also known as COPD, have a significantly higher chance of acquiring serious complications associated to the flu. Asthma attacks and COPD symptoms can be made worse by the flu's direct effect of raising inflammation in the lungs and airways, which can be triggered by the flu. Number 3. Diabetes. People who already have diabetes have a greater risk from the complications that are associated with the flu. Both diabetes and the flu can make it more difficult for the body to fight off infections, and the flu can make it more difficult to keep blood sugar levels under control. Diabetes can also make it more difficult for the body to fight off infections. Number 2. Compromised immune system. those with compromised immune systems, such as those who are now being treated for or have previously been treated for cancer, as well as those who are living with HIV or AIDS, have an increased risk of developing significant complications connected to the flu, including hospitalization and death. Number 1. Obesity. Serious flu-related consequences, such as hospitalization, are more common in people with a body mass index (BMI) of 40 or higher. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. Thanks for watching and have a wonderful day.